months of April and October arrive with a special focus on improving child health, and these 2 months are designated by the Ministry of Health each year to handle integrated child health days. In studios, I'm joined by none other than Emmanuel Bukalu. He is the EPI consultant for Ministry of Health, and he's here to shed more light on the issue of integrated child health days. Thank you so much for joining us.
My pleasure.
Yes, you can say hello to the viewer.
Good morning, viewers, and it's a humbling morning for us to be together this day on Saturday 23rd.
So, Emmanuel, the months of April and October, specifically October, because it's the one in the context right now, these are months when the Ministry of Health doubles the outreach in the areas of primary health care. Now, in particular, right now, you're looking at integrated child health days. Can you shed more light on that?
Okay, thank you, Patricia. And we have been doing this for more than 10, 15 years. And as years continue to come on, we intensify our advocacy and also community awareness on the elements of integrated child health days. It's a concept that came through because many of our parents, caregivers, would have a lot of missed opportunities to access healthcare services, especially in line with routine immunization. When we talk about routine immunization, we are talking about the whole course of immunization from the time the child is born to the time the child is 1 year. So when many issues come along the way, where mothers can miss a polio vaccine or a DPT hip vaccine or any vaccine, maybe they can't access geographically, financially, they can't access health services. So that's why the authors of these ICHDs thought through and they ensured that we can have a space of 6 months in between to ensure that those that have missed the 6 months, a few of the vaccines that have been missed can be caught up during those months. Okay. So April was designed, and also October. It's a space of 6 months, as I've just explained. So April is the same replication like we have in October. And what is this? From 1st October to 30th October, we intensify the routine immunization. We call it periodic intensification of routine immunization because we do it in seasons and phases. But the services we offer seem not to be so different from those that are offered in health facilities. But this time round, we take them closer to the persons that are in the villages and parishes through outreaches, even when we maintain the static posts at our health facilities.
Okay, so what you're trying to say is that this time around it gets more integrated. You involve clinics, you involve centers,
outreach
you involve
clinics,
parents. Okay.
Yes,
right.
and also more of the sounding of these very days to the public through what we are doing now on radios, through the sports you've just played, and many other things that we do.
Okay, so besides routine immunization, are there any other activities that run through this very period of integrated child health days?
So our focus in the child health days is both the mother and the child. Because and also the women of childbearing age, because we look at the tetanus and the diphtheria vaccine for the women of childbearing age. Way back when we were still in school, we used to do tetanus only. But with the advancement of technology and the necessity that we've noticed that it is necessary for us to include the diphtheria vaccine, and this has done good. But sadly, the uptake of these vaccines for the women of childbearing age is a bit low. And one of the reasons why we come here is to continue to remind our women that it's necessary for them to do that uptake. And also, we look at our 10-year-olds, the 10-year-old girls, for the human papilloma vaccine that saves them and guards them against cancer of the cervix. Okay. Patricia, it's quite expensive to manage cancer of the cervix. Radiotherapy machine, a few years ago, you were here sounding a lot of advocacy on the radiotherapy machine that actually went down in Mulago.
And you watched that?
And we were here, we were watching, and we saw the pains that people are going through. And now when you talk about the primary prevention, which is the HPV vaccine, some people shun away.
True.
Reasons because they have a lot of myths, they have misconceptions, they have a lot of misinformation that comes in, they have actually disinformation, and of late we have what we call infodemics. A lot of unnecessary information flowing onto people's phones and everywhere. So many people have become doctors and scientists.
Maybe because of the accessibility of
social media and the many search engines.
Yeah,
many search engines accessible, and people think that everything is authentic there. So they have gotten a lot of myths along the way. People think that HPV vaccine is a family planning method, which is not true. People think that we are sterilizing their children, which is not true. Because, Patricia, if we've saved the child by the vaccines for all this period, then we cannot undo our success at 10 years. That's not how we manage health.
A reverse.
Exactly. So why we come here is to reassure the public that even our own children actually take on these vaccines. And that is the safety that we acknowledge, the kind of vaccines that we give to every other child. It is the same community that we live in, and the same services we access as well. Yes.
I think in every area of life, it's not just in the area of primary health care, myths will always arise. Yeah, people have, when HIV and AIDS came, you know, a lot of people thought it was witchcraft and, stuff. But now a lot
cooked
of people
stories.
Yes. But we need to find ways to get a lasting solution to these myths. Maybe even before we think of engaging them more in these health activities, we need to have a training on mindset changing. So that these people can embrace well the routine of immunization. They can embrace well all these other activities that come up, not just for the month of April and October, but the usual routine of immunization. Mindset change.
That's perfect.
Health workers can engage that. They can include that in the simple orientation that they give to these mothers that go to the health centers.
Yeah, in our antenatal service care package, we have health education is a must. In our outpatients departments, health education is a must. But the focus keeps varying because the needs of the mother is beyond maybe the routine immunization. So we need to know how she's prepared for the delivery. We need to know how she's prepared for disease prevention. We need to know how she's prepared for nutrition. So these things keep coming through. But in our also the postnatal care clinics, our focus is majorly the health of the mother, but also the immunization status of this particular child.
Sure.
So one of the issues that we need to understand is that what do we vaccinate for?
Okay.
Yes? How many diseases of late do we vaccinate for our children?
The vaccinations
And to be efficacious or effective. When we look back in 1985, and we give our space of about 10 years, 1994, there was a very huge reduction of polio outbreaks and disease incidences by over 84%. Why? Because there was an increase in force of EPI activities. That's when actually UNEPI, around that time, 1983, and then an increase in the number of diseases that we had with the coming in of, I think, a more stable government that time. We had a more focused EPI activities. So 85% of these diseases, especially polio, reduced completely. When you look at that time when we had 6 killer diseases, we even branded them killer diseases.
killer diseases.
I've just seen the sport that you played. We now call them vaccine preventable diseases because they have ceased to kill our children. And now it only tells you that the advancement in technology and the need and the sustainability the government puts and the resources that are put in primary health care actually has seen our infant mortality rates drop.
Okay.
Then we had about 174 children per 1,000 live births dying. Each annual presence, every 366 days. Per 1,000 live births, you have 174 children dying. Currently, we are less than 30%. which is a very huge drop. And this 30, actually around 27 per 1,000 live births. Much of it is contributed to neonatal death. Neonatal is that space 28 days after the delivery of a child. Now, this whole thing tells us that immunization has played a very key role in reduction of this.
True.
So now our focus is now going to the neonatal wards and the delivery for the safe mother. And why is that so? Some of these mothers don't produce in our facilities. They go to other traditional birth attendants, maybe along the way, maybe in the gardens, and so many others. We are reducing a lot of perinatal deaths by focusing our skilled labor to this mother who is in our wards, and ensure that we can ensure this child survives all through and none of them dies through the vaccine preventable disease.
Okay.
We've increased the whole scope of vaccination from 6 killer diseases to 13 diseases.
13 diseases.
As we speak today. Next year, we are introducing new vaccines for our children. And this is for the need that we see focusing, because we don't want any person that can access a vaccine to miss out, and also for the health of that person to deteriorate because they have not received the vaccine. So 13 diseases, and which ones are these that we are talking about? We have TB, that is tuberculosis. Many people think it is a lung disease, but it can affect every part of the body, the stomach, the GIT, the bones. TB is so aggressive, it eats anything. We have leprosy. We vaccinate against leprosy. Way back, we used to have a lot of leprous patients. Now, almost you see just adults on the streets, probably with short amputated fingers or something. Yeah. Now we hardly see a child below 30. We can have a very good survey. 30 years below, we hardly have any leprous patient.
Immunization routine, we do have the leprosy vaccination.
People didn't know that.
But we're not told. So my children have been vaccinated of leprosy?
Perfectly so. Yes. Okay. Of late, I saw when we introduced hepatitis B in 2002, I've actually seen people vaccinating their children who are below 19 years against hepatitis, and I was wondering, what is this kind of hoax people are doing? Because this vaccine is part of our routine.
True.
Anybody above 20, fine. Me and you can vaccinate against hepatitis. But children who were born after 2002, they received this jab already.
Okay.
Yeah. So
that is the information that the healthcare professionals are not letting us know.
And the beauty is now we are doing it. Because then we thought that everybody will just come into the, and then we assumed that people will understand by default.
But we should also take this voice right to the very clients, the patients, the parents, we just can't sound it on media and that's it. It has to also be sounded within the hospitals, the health centers.
Yeah, in behavior change science, and of which I believe I'm an expert in that, we have many routes of communication channels that we can use. Mass media is one of them. Community dialogues is one of them. Interpersonal communication is one of them. And we think that we can use each bit to ensure that we can reach the very person that we want to target our message on.
True.
This child who is below 1 year, the decision made is actually from a parent. The child can't demand for service, but a parent, once they know the benefits of immunization, they would actually rush into
choice
that.
For the child.
That is it. Now, we have some cults and some cultural institutions and also some bits of religious cults that we've actually isolated that are resistant to this. In the COVID times, you've seen the very many anti-vaccine agents and the messages that have come in, which we anticipate if we don't fight it well, it can affect our routine immunization. So you and I have a role to play. Don't think this work is for only health workers. It is for you, Patricia, for everyone who is actually watching me, to ensure that this message reaches the very person.
And I'm doing my job right now.
Perfectly so. So if you send it to me, you're actually failing the system. Because if you know the benefits, pass it over. When we look at the socio-ecological model, our policies are clear, our Public Health Act is there, our Immunization Act is there. We just need to interest people to know this, okay? And once they read, the law enforcers know where to act when Our mothers are not taking their children for routine. We only at times see this during campaigns, but we actually need to do it even during routine. Parish chiefs need to know that their role is actually, one of their roles is to see their parishes welcomed with vaccines.
And promote.
Exactly. It is not just a Ministry of Health issue, but some people don't know. If all of us are serving the same population, and we are targeting a healthy population. So if a CD or a community development officer has this information, and you routinely meet with people and mingle with them, give them the health information as well. Just a simple package that you need to know.
Now, you know, Emmanuel, as me as a mother,
yes,
when I look at a disabled person, I really feel sad for them. So when I'm taking my child for a polio vaccination, I have that in mind. I would want to raise my child not like a vegetable, but like a very amazing, wonderful, a child that I have a hopeful future for.
Full potential.
So if we can have that mindset, then I don't think there would be any issues with vaccinations, with going for immunization. Yes, because you know that polio will hinder the whole lifetime of your child.
Yeah.
If at all they get this virus.
Now, Patricia, do you know why some people become a bit laxity? There is a bit of laxity in this. It's because people no longer see the disease that used to kill their parents, their children.
Because it's gone.
We've tried to do our best to ensure that it is wiped out of the populations. Most of us in the health sector actually have forgotten how some of these diseases present. For example, you could ask me if I don't go back into theory, I could easily miss a diphtheria case if it presented today. I could easily diagnose it into something else. You get it? Why? Because it's out of our system. So people think they no longer exist. But if we ever break that chain that we've continued to sustain for the past 30 years, it's easy to have an outbreak again.
Okay.
For example, as we speak, we have a polio outbreak in the country. Even when we've not identified a case of polio, but we see saturating vaccine-derived polio viruses in our environment. Yeah. So this is just trying to tell you that there is a bit of a breakage in the chain. And we have a bit of measles outbreaks, a few of them that keep coming in 2019, 2016, a few of these isolated cases. And you know why? It's because some mothers become a bit relaxed. Not even a necessity of mothers, but caregivers, including us fathers. You get it? So the responsibility then needs to shift from just a mere single mother.